Hello, family. I hope everybody is safe and well this evening. I want to just come on here real quick and make a video. My youngest is resting right now, so this gives me an opportunity to make this video, hopefully really quick. Um, this morning I was up around 6:30, making his breakfast, getting his medication lined up for the day, and just trying to make sure that I was as organized as I could possibly be in order to make the load a little lighter on me as I care for him. As I mentioned before, he's had all four wisdom teeth removed. He's 17, and so this is difficult. And his mama has been there before, had all mine removed years and years ago, and so I've got a lot of empathy and want to make sure that I bring him as much comfort as possible. However, as I'm checking, he doesn't like to take pills. He doesn't like to swallow pills. Back in the day, I didn't either, and so my sweet mama used to take the capsules and she'd break it apart and she'd pour the contents into orange juice so that I could get it down. And so I'm doing the same thing with him, breaking it apart and putting the contents in applesauce. And so I noticed this morning, I was led to look at the bottle that the medication was in because I was like, how many more times I got to do this? I just wanted to know how soon will it be over in terms of dispensing this medication, because I am on duty. And I just wanted to know, and he doesn't like taking the medication. So I'm like, for both of our sakes, how much more do we have to do this? And so the bottle said 20. And I bless the Lord that he doesn't want to swallow the medication. And I was led to take the capsules apart, and instead of throwing them in the trash, which I would have normally done, I didn't this time. I put them in a little bowl, and I would just, as I broke it apart, pour the contents in the applesauce, I would use that bowl as my I don't know, my dispenser. It held the capsules. Like I said, normally I would put that in the trash because it's not like I'm going to use it again. But that's what I was led to do. And so this morning I'm looking at the number of capsules left, and then the number of capsules that we've used. And I'm glad I did that and I'm glad he didn't want to swallow them, because I would have lost count of that. And so after I counted what was in the bowl, counted what was left in the bottle, and then looked at what the quantity that was supposed to be in the bottle, I was like, well, this doesn't add up. This doesn't add up to 20. There was 6 in the bowl, 6 in the bottle. And so I'm like, I'm lacking eight capsules, which are his antibiotic. He needs those in order to make sure that his mouth doesn't become infected, that the holes don't become infected. And so after I was done cooking the breakfast, I made a beeline to the pharmacy. I'm so glad I had my proof. I had my evidence. I showed the pharmacist. She immediately went and got me my 8 capsules. But I got in the car and I realized that I was so grateful that I cared enough. Now I'm taking care of my kiddo, but I'm so glad that I cared enough to count. I cared enough to make sure that the quantity that was written on that bottle was the quantity that we had overall. And when I recognized it wasn't, I was like, okay, no, this has to be rectified. This has to be fixed. But if I wasn't paying attention, I just didn't care, I wouldn't have even bothered to look at the bottle, the quantity, the count. And to be honest, that has happened one other time with my oldest child when he was a little boy, and the pharmacy dispensed it was the wrong medication. It wasn't even the wrong count. It was just the wrong medication. And I bless the Lord that got caught too. So I'm a pretty detailed person, but the fact that I did not throw away what he had already taken and just was led to keep it in a bowl, for me, that was just no mistake. And it made sure that I knew that this situation needed to be remedied in order to make sure that he has what he needs in order to be restored and to become wonderfully well. And so as I came home, I was like, okay. In 24 years of being a mama, this has happened twice. And so that I know of. And so I looked online and found out that medication errors are among the most common medical errors in the U.S. In fact, it impacts 1.5 million U.S. citizens every year. And obviously, if you're given the wrong medication, that can cause harm. And so it can be because the doctor has prescribed the wrong medication. Something has happened with the transmission of the information from the doctor's office to the pharmacy. The pharmacist gets the information wrong, reads it wrong, dispenses it wrong, all the way up until the person who's at home, who is caring for that individual, and they're not giving the medication in the proper way. They're not giving the medication the way it was prescribed. So it's not just the doctors, not just the pharmacy, it's even the caregiver needs to care and make sure that the medication is being dispensed or given properly if it's at home. And a lot of these errors from this report looks like happen in hospital settings too. And so I just wanted to come on here today and encourage everybody. Care enough to count, care enough to check, and just make sure that your loved one, who may not be in a position to check for themselves, that you as the caregiver, you as the professional, healthcare professional, you're just double checking. And listen, I realize we're all human, we make mistakes, but I recognize for me, I'm kind of that last line of defense. And so I'm checking the checking and the checking the check. Okay? I'm going to check. And I bless the Lord that He gave me a heart to care enough to check and to count this morning and make sure that we had what we needed in order for him to get well, in order for him to experience the healing that I know and believe God has for him. And so with that, I just wanted to encourage you tonight. Medication errors do happen. And if we are going to be wonderfully well, since it can cause so much damage and so much harm, just care enough to count, care enough to check, and make sure that the medication that your loved one is getting or the medication that you're dispensing is correct. Make sure you care enough to make sure it's correct so that they can be wonderfully well. All righty. I hope everybody has a great weekend. And until next time, bye-bye.